welcome to my social work education discussion talk, or for short, my SWED Talk. Today I'll be discussing the deep-rooted and oftentimes unconscious social stigmas of welfare benefits and how those beliefs have made a negative impact for those living in poverty. First, I'd like to introduce myself. My name is Crystal Harrington. I'm currently in the Masters of Social Work program at Wichita State University. I received my BSW at Wichita State as well with a minor in sociology in 2018. I'm a single mother trying to maintain a household as well as a helping professional, so this talk was developed not only from a social work perspective, but also my own personal experiences as an individual that once received benefits for a period of time. My hope from this discussion is that you gain a better understanding of misconceptions and myths surrounding poverty and how they have been attached to welfare benefits over time, creating social stigmas for those that receive them. I would first like you to take a moment and reflect on your own perception and knowledge of government welfare programs and its recipients. What beliefs do you hold? What image comes to mind? And if you've ever received benefits in the past, what was that like for you? What feelings do you remember when you were enrolling in services or using your benefits in the community? I want you to hold on these thoughts while we look at common myths in our society surrounding poverty. The most common myth we hear often is that those in poverty are lazy or expecting handouts. This stems from the pull yourself up by the bootstraps mentality embedded in our current system. The narrative suggests that benefit programs are counterproductive because they foster dependency. Also, the belief that if you're born poor, that's tough luck, but if you die poor, that's your own fault. You should have worked harder. If you look at evidence-based research, this is incorrect. The majority of Americans in poverty, 63%, actually work one or more jobs, and nearly 6 million Americans working part-time jobs wish they had full-time jobs. 35% of the poor who don't work are children, elderly, or disabled, so the idea of why don't you just go get a job wouldn't really work there. Not to mention, since the 1970s, wages have essentially stayed the same, while life has gotten much more expensive. For impoverished families in Kansas, $7.25 an hour, even at 30 hours a week to meet work requirements for TANF, is not a realistic wage to live on and provide shelter, nutritious food, and clothing. In my personal experience, I chose to work in the service industry where I could make tips and potentially more than the minimum wage. As a single teenage mother, there was very limited amount of high-paying jobs available unless I held a degree or training certification. This leads us to the next myth surrounding poverty, that if you just went to school and got an education, you wouldn't be poor and need assistance, which would be great if our school system wasn't based off local tax funding. The poorer districts have less money to spend than the wealthier districts, making it much tougher to succeed if you're in poverty. And it should be general knowledge that college isn't cheap by any means. The overall cost of college has increased 1,120% since 1978. College debt creates a poverty trap that is extremely difficult to get out of once you're done with school. As a college student, I made the decision to go to a school to have more opportunities, but not without taking out student loans that must be paid once I graduate. Keep in mind, those in poverty that do decide to attend college must find childcare, maintain a household, maintain employment to support that household, reliable transportation, all while managing coursework. The next common misconception of social welfare is that recipients are using the assistance on drugs and alcohol. Although drugs and alcohol abuse can be an issue for those in poverty, it is not the major cause. Because of this socially constructed stereotype, many states have implemented drug testing for welfare applicants. When looking at the data, the testing found the same results in every state. Those living at or below the poverty line actually had a lower rate of drug use than the general population. I would like to point out that this testing costs the states thousands of dollars to try and prove that welfare recipients are wasting their benefits. The next and most complex myth, in my opinion, surrounding poverty and welfare benefits is that those receiving benefits are mainly Black people. When looking at demographical statistics, as well as our country's history of systemic racism and oppression, this is clearly untrue. It is true that the rate of poverty for Black people in America is disproportionately higher, but the actual number of poor white people was 9 million higher in 2017. A research study published in the Association for Psychological Science found that when thinking about a welfare recipient, people tend to imagine someone who is African American and who is lazier, less competent than someone who doesn't receive welfare benefits. This mental image and its association with specific racial stereotypes influences people's judgment about who deserves government assistance. The researchers concluded that these strong mental representations contribute to growing inequality by triggering deeply rooted biases about how resources should be distributed and to whom. If you are a human being with a brain living in a society, you will develop some type of implicit, unconscious biases about race and or gender. But why is this? It's because we have been overexposed to certain groups in certain roles. The misconception that Black people are the main recipients of welfare benefits or living in poverty is created from this overexposure. Anytime poor people are presented in the media, it's usually poor Black people in the inner cities. This misconception negatively affects Black people greatly because there's a stigma placed on them just because of the color of their skin. This can also be seen in the use of the Southern strategy often used in politics starting in the 1950s. Instead of being outright racist, politicians used economical terms such as taxes, state rights, and welfare benefits directed at Black people to appeal to white Southern voters and obtain those votes. This strategy continued over the years in how welfare programs and benefits were represented to deter favor of federal spending or who should receive it. When analyzing the misconceptions, there is a clear lack of understanding of poverty that continues to be echoed throughout our society. The point of looking at all of this is to understand how these myths create stigmas for those that are wanting to apply or receiving benefits. The government creates aid for individuals in poverty, but then those same people are shamed or judged in society for accepting. I want to share with you my personal experience. I came from a middle-class family. I didn't experience living in poverty as a child, but growing up with a mother who worked in the social work field, I always had an idea that resources were available for those that needed it. It wasn't until I was 18 and pregnant and alone that I needed those resources for myself. I remember walking into the agency building, looking around and seeing the other people and thinking, I do not belong here. I had nice clothes. My son had nice clothes. We were clean. I lived in a decent area. Me, a person that needed assistance, walked in, judging the other people that were there for the same reason as me. I remember using my EBT card at the grocery store and felt as though people or the cashier would see my card and judge me. What groceries I had in my cart, what was healthy, what wasn't healthy. I didn't want to tell my friends that I was on assistance because I thought they would judge me. I was obviously embarrassed. I clearly had my own implicit bias of welfare benefits, and I felt the social stigmas of poverty that society had created. I see the stereotyping and biases today during the COVID-19 pandemic. I hear too often arguments about unemployment benefits and government stimulus packages. People are losing their homes, struggling to take care of their families, while others are angry that unemployment was unfair or provided an unnecessary extra $500 a month, or causing our country to be more in debt. I heard that people were just going to be lazy and spend their stimulus on drugs and alcohol. Everyone was worried about or judging what other people were spending their money on, instead of looking at how others were fighting for survival in a time of uncertainty. Looking back on my personal experiences in the past and in recent times of the pandemic through a social work lens, my question is, how can we help educate and encourage involvement from our communities to make a change? What approach can be developed to eliminate the misconceptions and misrepresentations of social welfare benefits and its recipients? What route can we take to reach government legislators and policymakers? This is not an easy feat by any means, but it has to start somewhere. It can start with having this conversation with your peers, friends, and family, helping those understand their unconscious bias and where it stems from, incorporating more poverty courses in the educational system on all levels, creating poverty and diversity training in the workforce, and even implementing policy change to current welfare programs and/or the restrictions to eliminate poverty traps. We cannot create safety nets if we are going to make people in our communities afraid to jump. Compassion, understanding, empathy, and our empirical research are the recipe to bringing awareness to poverty, and as social workers, we are the helping professionals on the forefront. Thank you so much for your time and listening to today's SWED Talk.